Good morning, Warwick. Thanks for joining us again this week.
Kia ora, Karen. How are you?
Yeah, I'm good. How you doing?
Yeah, good. Loving level 3.
Awesome. I love that. I hope you've not been one of those ones in the queues for McDonald's or KFC or something.
I'd be in serious trouble if I was, wouldn't I? Yeah.
Yeah, I think you just might be. Hey, we just want to talk to you a little bit today about complacency, I guess, and how you would respond to somebody who might be thinking, well, you know, I've been to the supermarket, which is a little bit of a cesspool really, and I haven't caught the virus yet. So I think I could relax a little bit more than's been suggested by the government. How would you respond to that?
Yeah, I mean, I can see why people are tempted because, as we talked about last week, the risk of getting an infection in general is extremely low. But I think we need to remember that this is a very contagious virus and we're still learning a lot about the virus. So, yes, in a quite a controlled way, because, I mean, we're not going to the shop the way we used to. I mean, you know, we have to wait in lines and we have to space out and we have to keep distance. So it's not the same as it was before the pandemic. So I don't think that that's entirely reassuring just because you've been to the supermarket. I think that we need to remember this is a new virus. We're learning a lot about it. It's very contagious. It can live on surfaces, and some surfaces potentially for up to 3 days. Whether it's still infectious at that point in time is uncertain, but we can still detect the virus. And so I don't think we can relax at this point in time. We're still getting every day, albeit in single figures, a small number of cases. So that virus is still out there. And again, not to put that out of context, because we can, through tracing, know where those people have caught the virus from. But where it occurs when we can't trace it, that's going to be a problem. And that's why we need to maintain the vigilance that they've asked us to maintain.
Yeah, I mean, and we certainly don't want to go backwards, hey, you know, like we said last week. So what if I've got some symptoms, but I'm thinking, look, I think it's fine. I think it's just a normal cold and the medical professionals are busy. You know, do we bother going to the doctor when we've just got sort of 2 or 3 symptoms or not?
Yeah, I think we need to actually be more vigilant than normal. So, of course, we're moving through towards winter. It's getting colder and the usual colds and flus will be around. You know, this is a virus that's very similar to those viruses and will have some similar symptoms. But the key is early detection. So I think as soon as we've got symptoms, rather than perhaps in previous years when we've tried to tough it out at home and think, oh, it's just a scratchy throat or it's just a mild fever or just a bit of a cough, we should seek advice immediately. And the ministry's advice is to call Healthline or to call your doctor urgently. And that's quite important, is don't just turn up, call your doctor and say, hey, I've got these symptoms, what would you like me to do? And the reason for that is you don't want to go and sit in the waiting room and spread your symptoms around, your virus around.
Yeah.
And, you know, they'll say, oh, yep, we'll come and see you in the car or phone Healthline or go to a testing site or they'll give you the advice you need. But to come back to your point about should I just ignore it? Absolutely not. This is the year when you get a scratchy throat, when you get a runny nose, and when you get other odd symptoms, because this virus is presenting in other odd ways, is to get advice and get it checked out. We really need to take it very seriously because this is a very contagious virus.
Yeah. Okay, good advice. And I guess just a little bit about... Sorry, go.
Sorry, I just wanted to say about the doctors being busy. At the moment, general practices are generally saying we are very quiet, and they're actually, as you would have heard, been asking for support from the government because people are staying away, maybe because they're concerned about getting COVID-19 or whatever. And we talked about this last week. It's really important that you go to your doctor for your usual visits and maintain your prescriptions. And, you know, if you've got other health concerns, please don't delay. The worst outcome would be is if people, you know, for example, have chest pain and they think, oh, I'm just going to ignore that. And it turns out that you're missing a heart attack.
Really important. Talk to us a little bit about this vaccine. I guess, you've mentioned previously that we're a long way off a vaccine. Why does it take so long to make a vaccine?
Yeah, so normally in vaccine development, it can take up to 10 years to get a vaccine developed, and that's for a number of reasons. The first is that you have to identify the virus. Now, we've already done that. So the Chinese sequenced the virus very quickly, and they released it to the world in terms of the sequence so that people could study it. And when you know what it looks like, then you can start to use parts of it to form a vaccine. Because that's the way the vaccines work, is you give the person part of either the makeup of the virus or a protein that it makes that can't cause infection itself, but it tricks the body into thinking it's been infected, so it announces an immune response. And that immune response has a memory function. So once you've had a vaccination, the body remembers having seen that protein before, and when you get the real bug next time, you immediately mount an immune response, and so you either don't really notice you're getting unwell or you have a very mild form of the illness. So in order to develop the vaccine, you first have to identify it, then you have to identify parts of the virus or its proteins that are made that you can use in a vaccine. You then have to test its safety in animal models and then in human models. So first for safety, because the first sort of law of medicine is do no harm. So it's no good rushing to develop a vaccine that in the end potentially does harm. And as you know, we've got a very sceptical public around vaccination. We've only too recently seen the devastation that was wrought not only in New Zealand but in Samoa, where because of mishaps with vaccines, there was an unvaccinated population and lots of people died. So we need to be safe. So the first step in that is to make sure it's safe. The second is to make sure that the vaccine will actually make the body develop that immunity, because not every vaccine that's developed will necessarily work at the first try. So you have to try different vaccines to see which one is going to give you immunity. And then the third phase of that is to make sure that that immunity is long-lasting and that it prevents you from getting the infection. So all of that takes many, many months. Now, remember I said at the start, typically this could take 10 years, but there's massive collaboration across the world, and the WHO, the World Health Organization, is coordinating all of these efforts. And there are already those early stage trials occurring across the world. There's about 6 or 8 of them running at the moment in those safety stages. So working out, is it safe to use this vaccine? And then we have to work out, is it going to develop an immune response? And that's going to be about 6 months to see if you've got an immune response that lasts. And then we've got to make sure that people don't actually get the virus from it. So we're hoping that within 12 to 18 months that we'll have a vaccine. But as you can see, it's not a straightforward process. I understand there's something like 120 candidate vaccines that are being considered at the moment. So this is a tricky business, but with the collaboration across the world that's occurring, I'm very confident that we will get a vaccine, but unfortunately it's not going to happen quickly.
In a hurry, yeah. And I mean, what I love about that is the collaboration, I love how the whole world has really come together on this, and instead of competing, working together to, get a good outcome. So that's great. And I know there's lots of incredible minds at work at that. And so, I guess we just hope and pray that we get one sooner than...
And I mean, that's been one of the myths circulating at the moment, that somehow the medical profession created this to be able to make money from a vaccine. I mean, how utterly bizarre and nonsensical is that? When you see how hard it is to actually make a vaccine that works, yes, there's vested interests and so on, but at the moment, those have all been put to one side for the good of humanity across the planet. And, in our country, which is a relatively well-off country, we're doing okay. But when you consider that there are many countries that are have very low incomes, who do not have the ICU support that we have, a vaccine is going to be life-changing there. And I guess that's the other bit about the vaccine is once we know that it works and it's safe, is we have to roll it out across the world in an equitable way. So, and that's to many billions of people across the world in order to make sure that it's effective.
Huge. Hey, thanks, Warwick. Thanks for explaining that to us. Thanks for joining us again this week. We really appreciate it. Stay safe.
You're welcome. Take care too, Karen.